And Sherwin joins us now live from New York. Sherwin, thank you. So initial media reports suggested that even the Vice President, Mike Pence, would go into some sort of self-quarantine because, as you reported, his press secretary tested positive. But the White House earlier saying not. What's the latest?
Yeah, the White House coming out with a statement earlier today, Francis, that the Vice President would not be quarantining. They affirmed the fact that the senior staff in the White House, including the President and the Vice President, get a daily test for COVID-19. So far, the VP has tested negative, but we do understand that the administration officials are going to be keeping the two leaders apart. Essentially, the White House will not allow the Vice President and President Donald Trump to interact directly out of an abundance of caution. But what this is doing is really complicating the White House drive that really has been leading the frontier towards reopening various state economies across these United States, now really grappling with really containing an outbreak of this virus within his own house, essentially, the White House, where you have key staff members, particularly leading the coronavirus task force, as we mentioned in that package, Francis, who are now self-quarantining, including the leading infectious diseases doctor, Dr. Anthony Fauci. So we don't know the extent to which this virus might have spread. That might become clearer in the days ahead in terms of how broad-based it might have become, certainly in the White House precinct.
And you'll follow that for us. Let's look at the big picture. So the United States edging towards the staggering figure, and it's incredible to say, 80,000 dead in the United States. New models suggesting the death toll will rise, particularly as most states, like you said, are moving to reopen their economies. I mean, Sherwin, how much worse does this picture get?
Much, much worse, certainly according to some of the modeling we are now seeing, Francis. You'll remember that initially the Institute for Health Metrics and Evaluation attached to the University of Washington months ago had predicted that the death toll would be in excess of 100,000. It then downscaled that to around 60,000, but as now, with additional information being input into these models, the prediction now certainly is around 137,000 Americans will die by early August. So this isn't necessarily a full picture of how many people in the United States could die, but this is a figure that in terms of how many people could die, certainly in the next 2 to 3 months. The IHME director, Dr. Christopher Murray, says the uptick in their forecast is due to the reopening of states and the mobility you are now seeing in some of these states. People are moving around, there's traveling. In fact, I saw a figure earlier from the Transportation Security Administration, the TSA, these the security officers that screen travelers at airports. Last Sunday, they screened 200,000 passengers. And that's up from a week earlier of 128,000 passengers. So almost an increase, almost a doubling in the number of foot traffic we are seeing at airports around these United States as states begin to reopen. And of course, with that, a fear that you're going to see an uptick in the number of cases, an uptick in the number of hospitalizations. And of course, according to that model, 137,000 deaths by August of this year.
Sure. And I'm sure that fear is rising where you are, New York State, the epicenter of the disease in the United States. And it set 7 criteria for reopening parts of that state's economy. Just tell us what they're looking at, those benchmarks that government is looking at there.
Yeah, remember, Francis, that of the 80,000 that have died in the United States, more than 25,000 come from New York State, in particular New York City. Mayor Bill de Blasio earlier today talking about the idea that New York City will only be able to reopen once you get into June, and then, having to evaluate data then. So certainly not in the month of May. We've also heard from Governor Andrew Cuomo, the governor of the state of New York, and he has laid out 7 criteria for reopening. And of course, this will be done in different regions. So the entire state, for example, won't reopen at once. You have northern territories in sort of the rural parts of the state that will go first. New York certainly not going to be, New York City certainly not going to be leading the way. Some of the criteria, the 7 criteria, 14 days of declines in hospitalizations, things you've heard before, 14 days in declines in deaths, in hospitalizations, Hospitalizations need to be below 2 per 100,000. At least 30% of hospital beds need to be unoccupied. At least 30% of ICU beds need to be available. At least 30 tests for every 1,000 residents per month, and at least 30 contract tracers retained per 1,000 residents. So hospitalizations, declines in deaths, and then the ability to test and the ability to trace and isolate infected patients. So a very scientific and data-driven approach from the Democratic governor of New York, Francis.
Sherwin, finally and very quickly, can you just tell us a bit more about what the UN chief was warning there? You played him in that insert, warning against a rise in xenophobia, racism, scapegoating amidst this pandemic.
Yeah, really sounding the alarm. You know, in times of economic distress, I think that countries are facing, from South Africa to all the countries around the world, there is a very big concern from the United Nations in terms of xenophobic and racist and scapegoating creep, if you will, into the narrative. And so his message is very, very clear. 3 quick things. He's calling on political leaders to show solidarity with all members of their society and build and reinforce social cohesion. He's called on educational institutions to focus on digital literacy and also to reject some of the hate you are seeing online. So very much a forward-looking approach here from the Secretary General, given the social and economic stress that communities around the world will be facing in the days ahead.
All right, thank you very much. Sherwin Bryce-Pease live for us.